People often ask me about the rapid changes because when I work with people with depression and anxiety, it's not unusual to see a complete elimination of symptoms after a single extended therapy session, like maybe 2 hours is what I like to have available, and I see the depression and anxiety typically go to zero. Like people go from intense suffering to feelings of tremendous joy. But it doesn't happen for everyone, and some people are much harder to treat than others. And what's the greatest barrier to recovery, to changing the way you think and feel? The answer to that is motivation and resistance. We all have mixed feelings when it comes to change. And when patients are sticking with negative thoughts like I'm a loser, I should be better than I am, I'm going to be depressed forever, there's almost always a subconscious resistance going on. There's a part of the patient that's fighting against change, as well as a part of the patient that wants change. And what's really cool about team therapy is I've developed powerful new techniques to bring that resistance to conscious awareness and melt it away with a number of new and innovative techniques like the magic button, positive reframing, the miracle cure question, the magic dial, and many other techniques. But the quick and simple answer is unaddressed motivation and resistance. Now, another question is, well, then why don't therapists learn your tools for eliminating and reducing that resistance? And the answer to that is, I wish to hell that they would. But it's hard. They're hard to learn. They're not easy techniques. They're paradoxical, and you have to become a part of the patient's subconscious mind and see why they shouldn't change, why they resist change, and try to sell them on that and see that that's an expression of something actually beautiful about them. And the paradox is the moment you see that, rapid recovery is just a stone's throw away. And the reason very few therapists can learn to do that is because most therapists are addicted to helping. And as an aside, if you'd like to learn some of these tools, our Feeling Great app, we've trained it to do the same kinds of things as I do in a therapy session. It's not a therapy tool. It's an ultra sophisticated self-help tool. But you can learn how to deal with your own resistance. The app has been trained to do that. So if you'd like to see, or if you're a therapist, you have patients who are resisting, they'd like to check out the app. It's really great. It's the student I always dreamed about having because it does what I tell it to do. And it's opened doors for many, many patients struggling with feelings of depression, anxiety, loneliness, hopelessness, anger, and so forth. End of dialogue. Great question. Thanks.